Good afternoon, everyone. This is Anna Ricklin, Planning and Community Health Center Manager at the American Planning Association, and I welcome you to this afternoon's webinar with AARP featuring their Livability Index. This webinar is being presented as part of APA's Plan4Health project, which is a project that we are fulfilling in collaboration with the American Public Health Association with support from the Centers for Disease Control and Prevention, and which features 35 local coalitions working in communities across the United States to build the partnership between planning and public health and, of course, benefit local residents through strategies that get them more physically active and eating healthier. So this afternoon we are featuring, as I mentioned, AARP's Livability Index, and we have Jana Leinot, AICP, on the line. Jana is the Senior Strategic Policy Advisor in Transportation and Livable Communities at AARP's Public Policy Institute. She's based in Washington, D.C. And we're going to hear about the AARP Livability Index, which is a really great tool that has just rolled out this year and is useful for planners of all ages in all kinds of communities. And as we're going through the presentation, which is just a half hour, so we'll be wrapping up by 4 p.m. Eastern Time, please feel free to chat your questions in our chat box on the right-hand side of the screen, and we'll have time at the end to answer your questions. So Jana, please take it away.
Well, thank you very much, Anna, for having me join the webinar today and share our Livability Index with the group. I'm, again, Jana Leinot with AARP's Public Policy Institute. I'm a city planner and now Senior Strategic Policy Advisor with the Public Policy Institute and also the project manager on the Livability Index project. This is a really exciting time, I think, right now for our profession. Not only are we confronting profound demographic change, both in terms of the aging of society as well as increasing diversity across our nation. It's also a time when I feel that there's an increasing number of allies out there that are really backing up good planning and are approaching our work from the health angle, and a lot of opportunities for collaboration across, different disciplines linking around the concept of better health for everyone. So just as an example, I was at a conference yesterday of nurses where I shared the Livability Index, and one of the speakers was from the Robert Wood Johnson Foundation, one of the nation's top health foundations. And they are really pushing an entire culture of health right now and encouraging health groups, even like this very large nursing organized campaign, to get out of just their clinical area and move out into working more holistically in community. And so part of the message I delivered is, how do you work with planners in doing some of that work? And I think that's a lot of what APA is doing through the Plan4Health project in making those types of connections. So I'm really excited to look into the future over the next few years and just see all kinds of great things that are going to happen. Now, along with this, I think there's been a number of great tools that have been developed, and I'm going to talk about one of those tools, our AARP Livability Index, Great Neighborhoods for All Ages. And what this tool does is it basically allows you to type in a location and get a score. And we score every neighborhood and community across the United States, whether you're an urban area, a rural area, north, south, east, west, central. We've built this up from the ground, from the neighborhood level up, the census block group on up. It's an index for all ages that we very much want to emphasize that point. So, and as I go through there, I think that will become very evident. So this is our entry screen, and we've tried to, even though we've pulled data from more than 50 different data sources into the index, we've really tried to keep the interactivity in the design and layout of the index very friendly to a casual user who might just go in here out of curiosity to see how their neighborhood compares to other neighborhoods in the community or across the state or across the nation. Some folks have used this to say, hey, you know, I'm retiring, I'm looking for a new place to live in my retirement location. Let me test out the score for these different top neighborhoods or top communities that I'm looking at. So it can be used for a number of purposes. But our real intent behind building the Livability Index was to try to catalyze community conversations around what is it going to take for our communities to become more livable for people of all ages. You know, we're looking at this profound demographic change. We do see that although there's been communities who have tried to tackle what this demographic change means, we know that all communities can do more in becoming more livable, and we really want to push that conversation out and help people visualize and understand that livability is really quite broad. And the way we define livability and the things that we're measuring in the index are basically summarized here on the home page. We have 7 categories of livability: housing, neighborhood, transportation, environment, health, engagement, and opportunity. And we recognize that there's a lot of interaction between each of these, but this is a way that we were able to kind of break these 60 indicators of livability down into these 7 categories. So this, again, this is our home page with this information. We very much want to encourage you to join our conversation on livability and the Livability Index. We're using hashtag #LiveIndex, and these are some of our key Twitter handles if you would like to join that. So let me go ahead and type in let's see if I can. Well, I'm going to type in a city level. Location, and I entered La Crosse, Wisconsin, because La Crosse is actually our top scoring community across the United States, and it won our top scoring small community, but really its overall score was right there at the top as well. And because I entered a city name, it's returned a score for the city as a whole, and these white squiggly lines define the city boundaries. If I had entered an actual address of La Crosse, Wisconsin, it would have returned a smaller geographic area of the census block group where that address falls, which is how we're defining neighborhood. It corresponds to the level of geography of which data is broken down by that we could use. So, and that is true, you know, there are different levels of geography that you could return a score. You could also follow the breadcrumb trail and go from La Crosse outward to La Crosse County, and it circles the full county, and you can see the score has changed. It's somewhat dropped, that the city is more livable in our index in terms of its score than the county as a whole, and you can go on out into Wisconsin as a whole and see how the score changes. And the higher levels of geography, those scores are based on the average of all of the census block groups or neighborhoods within their geographic boundaries. And that's why the score changes, because it becomes more of an average. So let me go back to La Crosse itself. It only took me back. Okay, La Crosse. So we're back at the city level. And again, scores are on a scale of 0 to 100, with 50 being the midpoint. Anyone who scores above 50 is above average. Our top scoring city is La Crosse at 70. And so don't interpret your score on a sort of a school type of grading system. It's more the scale is more compressed than that. Our top scoring neighborhood in the United States is a 78. And that neighborhood is found in Madison, Wisconsin. So Wisconsin actually does very well in our Livability Index. Then the total score is comprised of the scores of each of the categories of livability. And each of these categories has equal weight building up to that total score. Then within the category of livability, we are building that score up from the calculation of how the community or the neighborhood performs against several different metrics or indicators of livability, of housing livability in this case. So for the housing indicators, we're measuring basic passage, basically the percent of, and you can actually open up to get a fuller definition of what we're looking at, a paragraph for each of our indicators, some of the rationale, and then a link to the original data source. And so in this case, we're measuring whether the percent of units in the community that have extra wide doors or hallways, floors with no steps between rooms, an entry-level bedroom and bathroom. And you also can see for each indicator at what scale we're pulling the data. In this case, we have metro area scale indicators. Not all of our indicators are down at that neighborhood level. So of our 40 metrics, 21 of those metrics across these 7 categories of livability are at that neighborhood scale. And the balance are at a metro area scale or county scale, etc. So once we have calculated the score based on the metrics for a given category of livability, we add policy points for each of the policies of that category that particular community has in place. So in this case, we are trickling down a state foreclosure prevention and protection law and giving credit to all the communities within the state. But we have a different methodology depending on what the policy is as to whether we give state credit to localities for state policies. So for instance, local housing trust funds or state housing trust funds, we wouldn't necessarily trickle that down. We wouldn't trickle that down. But that's probably getting it more into the weeds than I need to go at the moment. Let me just talk a little bit through these other categories of livability. For our neighborhood category of livability, this is really the city planner's quintessential definition of a live, work, and play community. And we get a lot of questions on this because oftentimes people get a red dot next to our metric access to grocery stores and farmers markets or access to parks. And they email me and say, hey, we have grocery stores in our town. We have parks in our town. And what we're actually measuring here is whether your neighborhood is within walking distance, a half-mile walk, of these types of services. So it's really the population centroid of the census block group half-mile out. So it's a fairly high threshold to meet. And in addition to these proximity indicators, we include the number of jobs that are accessible within a 45-minute transit commute, as well as auto commute, the diversity of destinations, sort of measuring mixed-use neighborhoods, activity density, and then added to those indicators are personal safety, crime rates, and vacancy rates that constitute the neighborhood category of livability. And on the policy side, at this point in time, we really are only looking at one policy specific to neighborhood, and that's whether there's a state or local transit-oriented development policy of some type in place. So let me also mention, under each of these categories, we are giving an additional policy programmatic point to communities that have made a significant commitment to becoming more livable for all ages over time. And you can get that policy point by joining AARP's network of age-friendly communities, and there's a couple of other ways in order to get those policy points. On transportation, we are measuring the frequency of local buses and trains. Here at the top and at the bottom, we are measuring how accessible that fleet is, whether people using wheelchairs are able to use the system. We have also worked with the University of Utah's Metropolitan Research Center to model walk trips down at the neighborhood level, and that's, I think, a real contribution to the data that's out there today. We measure traffic congestion, absolute transportation costs at the household level, speed limits, and fatal crash rates under the metrics. And then policies include whether there's state and local policy on complete streets, policy on human services transportation coordination, and state policy that's supportive of volunteer driver programs. Just one more mention of the commitment to livability, age-friendly communities. While it appears under each of these areas, because it's very cross-cutting, a community is only getting one total policy point for being part of our network of age-friendly communities. Our environment category of livability are largely indicators of air and water quality, drinking water quality, regional air quality, near roadway pollution, basically the percent of folks who are within 200 meters of a roadway with 25,000 vehicles a day, so pretty much any roadway of 4 lanes in most urban areas. And then finally, local industrial pollution. And on the policy side, we're looking at whether there's state policy that prevents utilities being cut off during seasons of extreme heat or cold, whether there's a multi-hazard mitigation plan in place approved by FEMA, and whether it's in a state that has basically scores in the top 25 percentile on the American Council for an Energy Efficient Economy. So under health, these are all of our health indicators, including smoking rates, obesity rates, access to exercise opportunities, whether a neighborhood, basically the number of people who are exposed to a healthcare professional shortage area. And these are areas where either there's a shortage of physicians, primary care, doctors, or because of poverty rates and a lack of transportation, people have difficulty accessing health services. Then we also look at the preventable hospitalization rate and patient satisfaction. And on the policy side, we are looking at places with state smoke-free air laws, and those are comprehensive laws that cover offices, restaurants, and bars. Now, I should point out that even though we have this health category of livability, really when you think about health, it's important to understand what's happening under all these other categories of livability as well. There's a lot of social determinants of health, so housing affordability, transportation. There's been some great research done by Harvard and other research by New York University that shows that having access to public transportation is actually a more influential factor in one's ability to get out of poverty, as elementary school test scores, as single-parent households, and there was another indicator in that study that I'm trying to remember, but it's having the ability to get to a job and to improve one's standard of living is so important to sort of our overall family health and individual health and public health. Obviously, air and water quality has health implications. Whether the neighborhood is designed in a way that people can easily walk to different destinations, that's largely what's being measured under our neighborhood category of livability. And then under engagement, we look at things like the social involvement index, and there's lots of research as to how important it is that older adults stay socially engaged, and those who are most isolated actually have some of the worst health outcomes. Within engagement, we're also measuring internet access, broadband cost and speed, and this is another one that elicits quite a few questions, and the way we measure this, it's a very high bar that needs to be met. So you have to have 3 or more wireline internet service providers, and 2 of those providers, at least 2, offer maximum download speeds of 50 megabits per second. So that's a fairly high threshold to meet. Then we also look at civic engagement, voting rates in the last presidential election, and then social engagement, sort of access to cultural arts and entertainment institutions. On the policy side here, we look at state barriers to community broadband, or kind of the prevention of the removal of those barriers, or whether there are barriers in place. And there are states out there who would have basically made it illegal for communities to build community broadband networks. We measure whether communities have our state laws that allow early, no-excuse absentee or mail-in voting, and then whether the community has a local human rights commission as tracked by the Human Rights Campaign, and then under equal rights, total score of 75 or greater on their equality index. And then finally, under opportunity, we measure income inequality, jobs per worker, high school graduation rates, and age diversity. And on the policy side, if your community has a AAA bond rating on Standard & Poor's, you would get an extra policy point. If your state goes beyond in offering beyond the federal minimum wage for higher wages, and whether there's an expansion of the Family and Medical Leave Act at the state level can get you an additional policy points. But just going back to the metric side, we know that income inequality, high school graduation rates, early childhood education, these are all such important elements of health that need to be measured and can certainly be talked about and presented under the context of health.
Hey, Jana?
Yeah.
Actually, right in that, connecting to that, we've had a question come in about has access to public schools been a factor that was included in the index?
So we considered a measure for proximity to schools and decided not to include that. We were getting almost too many of those proximity metrics relative to the number that we had in other categories. So at this point in time, the only thing on education is the high school graduation rate indicator. There are a couple of other features I'd like to show folks. I realize time is running low, and I've just had pre-entered some other cities. But if you click at the bottom of the screen on compare locations, you can line up 3 different jurisdictions, or really at any scale of geography from the neighborhood level on up to state, and then get a side-by-side comparison on each of the categories of livability, as well as if you wanted to make a comparison of differences, you can open up one of the plus signs and then actually compare the performance on the various indicators, including the policies for each of those. I'll click on Atlanta at this point in time, so that will take you back to a score for the community. And you can customize your score. So that allows you to change the weight of the different categories of livability. And I don't know, so for instance, maybe Atlanta is feeling that the data that we've pulled is maybe a little bit out of date, or they feel unfairly penalized under our index, and they could make this less important and see their score rise from 49 to 54. It allows users to play around and see what happens when you change the weight to the different indicators. Your official AARP score that you would print out go to that now, will always be what first pulls up, not the customized score. So in the way you can do that, say you want to take a printout to your city council, county board, you can click the PDF profile and then generate a PDF that has organized each of the categories of livability by where you score above average, at average, below average, and then you can also, it gives a page for each of those categories of livability and the performance on each of the indicators. That's just one tool that we've provided. Then was there anything else I needed to show? Just enter Washington. You see, Anna, is there another question while I'm thinking about if I missed any of the other? Oh, I missed a major feature. Our map layers. This is a lot of fun to play around with because you can visualize what's going on in a lot of these cases. It allows you to map things like demographic information as well as how the community looks across the community on the different scores of categories, the total score, as well as some of the indicators. And so you can, for instance, if you're interested in walk trips, you can click on that and see how the walk trips change as you move across the metro area, with green being the highest number of walk trips per household and red being the lowest. And there's lots of those things that you can play around with. And in terms of, some of the health things that you can map, smoking rates, obesity rates, access to exercise opportunities, health professional shortage areas, and life expectancy, as well as median income, upward mobility. Just a note of those that have an asterisk next to them. They're things that we allow you to map, but they don't actually count toward the score within the Livability Index. But really fascinating information here if you play around with it.
That's great, Jenna. And actually, I think one of the other questions is, beyond planners who are, many of whom are on the phone now, and public health folks, who are some other audiences that you might recommend this tool be used for? Could it be used as a way to, for planners to use in public meetings, for example, or to use with citizens, general citizens, or other audiences?
Yeah, we really hope that folks will take this tool. It's publicly available for free, and we would love it if you took it into your community meetings and used it as a tool. We've been doing that through our state offices. As part of our rollout of the index, we started by rolling it out at the national conference at APA last April, and now we've been rolling it out in states, in local communities with state offices. And many of those, what we call our Livable Community Solutions Forums, have had the iPads at the table or in a hall where people can go in and try it out, and they'll use it as part of the conversation around how do we become more livable, just looking at where are our strengths, where are our relative weaknesses, what do we know from the local knowledge about this community that can help us interpret the results from the Livability Index, and really hoping that it's a way to have those conversations and move toward making some very concrete action steps toward becoming more livable.
And someone else had a question about if they see something that doesn't look accurate when they're looking at their community, is there a way to send you information or just flag something that might not be as accurate as they might be seeing it in their community?
Yes, we would love that information, and the best way to get that to us is through Livability Index at aarp.org. And we are checking those emails, even though we may not get back to you in a super timely way. We are currently undergoing an update of the data in the index, and so we'll be looking at that type of feedback and trying to feed that. If it has to do with we've missed your policy, and you should be getting that extra point, then we will send your information on to the original data source. Typically with policy data, it's nonprofits who collect information and make sure that it gets into that master database, spatial database as well.
Well, this has been great. This half hour went by very quickly.
I know, it really does. Let me, if I may, I wanted to make sure people were aware of 2 other great websites out there for linking health and planning. This website is in part funded through Robert Wood Johnson Foundation. It's buildhealthyplaces.org. And under Measure Up, there's actually a link to a number of other tools that can be used for health planning. And then another favorite of mine is communitycommons.org. And within here, you can actually download lots of different data sources for the nation and for your community. So our index, I think one of the strengths is that it has a very intuitive interface, very approachable, accessible. But at this point in time, we don't allow you to download our data. So where can you get data? Community Commons. It's a great site. So, and again, to find our index, we're at aarp.org/livability index.
Great. Thank you, Jana. It's been really wonderful to learn all of this. I was involved in some of the early conversations about the categories for what should be included in the index, but haven't played around with it as much as I should. So it's been great for me, too, to see this. And glad so many people could join us on the line today. And I hope you all have a great afternoon. Thank you.
Thank you.